Good afternoon, everyone, and welcome back to another Build Initiative Home-Based Child Care webinar. Today we'll be continuing the discussion we began earlier this year on the importance of home-based child care educator wellness. Today we'll hear from HomeGrown, who will share with us how educator wellness is embedded in their evidence-based framework for high-quality home-based child care. I'm Danielle Fuentes Johnson with the Build Initiative, and I'm joined in this work by my partner in this work, Gina Capito. As you join into the webinar and we're getting started, please feel free to place in the chat box where your name and your location so we get a sense of who's out there. With that, let's go to the next slide and take a look at today's agenda. So first, we're going to welcome you back, and then we're going to invite Natalie and Karen Tylek to share an overview of how evidence-based framework for high quality can support educator wellness, home-based child care educator wellness. And then we're going to dig deeper into the what and the why around the benchmarks, and we'll hear directly from Danielle Caldwell and Ainsley Herron, who'll share with us what this looks like in action. And then we'll talk about next steps. So let's go to our next slide and our core beliefs. Just for a quick recap, that in all of our webinars, we base them all around the core beliefs that home-based child care, whether it's family, friend, and neighbor, or family child care licensed, are part of the fabric of mixed delivery system for early care and education. That the strategies and components for supporting this form of care should be resourced on par with center-based and school-based settings. Also, that the strategies to work with the providers and educators in these settings should be responsive to their needs and intentional in the development to be as unique as the modality of care. And lastly, that family child care needs to be approached in a systemic way across the various federal initiatives and private funding opportunities in order to leverage these fully while also keeping a laser focus on the best practices for family child care and home-based child care. So next slide, please. As you may have heard, I just kind of went in and out of a couple of different terms, and we see home-based child care as inclusive of wherever children are cared for in a home setting. So in different states and different communities, it can be referred to in different ways. So it can be family child care, family friend and neighbor, licensed, unlicensed, kiss and kin, registered, unregistered. There are many different ways to refer to this form of care. And we'll go in and out of all of those terms. And we also know that the educators, the ones providing the care and education for these children, see themselves differently. Some see themselves as providers, some as educators, some as owner-operators, practitioners, or some combination of all of those. So as we're thinking about and are just about to transition and introduce and invite our presenters to come in, I live in the Blue Ridge Mountains, and it's just starting to feel the little nip of chill in the air in the mornings and into my favorite season of autumn. So with autumn just a few days away, the official launch, could you take a minute to place in the chat your favorite autumn wellness activity, something that brings you peace connected to the autumn season? Give you all just a moment to do that. Oh, crunching leaves, walking with the dog, walking on a beach, hot coffee. I love all of these. Making soup. Oh, my goodness. Picking apples. All of these things, yes, they are on my list for sure. Absolutely. Great. Well, I think I will have to make a list when we send, as always, this is going to be recorded, and you will receive the PowerPoint as well. And we might just have to make a note of all those fall-based wellness activities and send those out as well. With that, I would like to introduce and welcome Karen and Natalie.
Next slide, please, Ingrid. Hi, everyone. My name is Natalie Renew, and I am the Executive Director of HomeGrown, and I am really so grateful to Build for inviting us today and to all of you for spending this time with us. Next slide, please. HomeGrown is a national collaborative of funders focused on improving quality and access to home-based childcare Like Build, we define home-based childcare in the most broad and inclusive way possible to include both the small businesses we call family childcare, as well as the many diverse forms of family, friend, and neighbor care that are so critical to our families and communities and meet their childcare needs. HomeGrown exists because while home-based childcare is the most prevalent form of childcare in this country, it has historically been the least appreciated, and it is by far the least resourced form of childcare in this country. We know that home-based childcare is a first choice for many families, and in order to support those families, we need to better support home-based childcare, and that's the work we try to do at HomeGrown. So I'm really happy to turn it over to my colleague Karen to dig into our efforts around building comprehensive networks.
Great, thank you. So hi everyone, I'm Karen Tylek. I'm the Director of Program Operations with HomeGrown. If we can go to the next slide. Going to talk a little bit about our work with comprehensive networks and why we think it's important to focus on networks. So I'm sure everyone on the call recognizes that networks are an important structure for supporting home-based childcare providers and the families that choose this care. Of course, the idea of networks is not new. Networks take many forms: staffed family childcare networks, CCR&Rs, associations, unions, and many of these already provide really important supports for providers and families. But the pandemic brought into sharp relief really the need for comprehensive infrastructure to support home-based childcare. So during the pandemic, there was an increased demand for home-based childcare, but limited support for the caregivers and providers. So we saw financial hardship in the form of closures, increased costs, lack of distinct and timely information that was specific to home-based childcare, limited access to federal benefits and supports, especially for family, friend, and neighbor caregivers. And it really illuminated the need for a comprehensive network strategy. So on the next slide, we have a graphic that HomeGrown developed in partnership with the Erikson Institute. What we call a comprehensive network strategy is the totality of what you see in the graphic here. So it's everything from the public policy and funding entity in teal through the network hubs delivering the services, and then crucially, the providers and families. It's durable infrastructure that uses a publicly funded network hub to offer services that allow providers to offer high quality programming, to be financially sustainable and offer continuous care, to connect children, families, and providers to comprehensive services that support their well-being, and to promote provider well-being, which we see as a really crucial component of network success. We need thriving providers so that we can have thriving children and families. So a comprehensive network strategy facilitates payment and policy information to support home-based childcare providers. It gathers and utilizes data. And we want to emphasize that a really essential component in this view is that a comprehensive network strategy is informed by provider leadership and responsive to provider and family needs. It's not a top-down approach. So there's an emphasis on coherence with a vision for achieving these types of important outcomes for providers, families, and children. So if we go to the next slide, we took this concept of a comprehensive network strategy and launched an initiative called Building Comprehensive Networks in 2021. We currently have 2 cohorts of state and local partners that are working to plan and implement their network strategies. In the planning phase, sites receive a grant, they participate in learning communities, they receive support from a HomeGrown planning navigator, and have access to a number of open source resources. And then they're eligible for matching implementation funds. We're now collaborating with some state-based partners, including the Blue Cross Blue Shield Foundation of North Carolina, their community-based partner, MDC. In Michigan, we're working with ECIC as a learning partner to support their work with family childcare networks in Michigan. And as we have been collaborating with the network, the state and local government partners who are committed to building this infrastructure, it helped reinforce this idea that we actually needed to articulate a clear vision for the services, the practices, and the supports that a high quality comprehensive network would offer. We needed a more detailed vision of what networks can be and what networks should be in order to support providers and families. And essentially, we needed network benchmarks. So I'm going to pass it back to Natalie to talk a little bit about the creation of the network benchmarks and indicators.
Great. I'm dropping in the chat the report, and we can get into a little bit about why this report exists. So next slide, please. The purpose of this initiative and this report, as Karen said, is to really articulate a vision for both the services, activities of networks. We know that networks have both been a proposed and an actual strategy for supporting quality improvement in home-based childcare for a long time, and that there's a lot of policy attention and a lot of interest both within government and in communities to establish and to build networks that can deliver services and supports to home-based childcare. The purpose of this document, and despite that, there really hasn't been, a set of indicators or research that's compiled to guide that work. So the work here is really intended to be a starting point for articulating what a high quality, equitable network might look like and how it might operate and what kinds of services it may offer. This project is a collaboration between the Erikson Institute and HomeGrown, and we're so grateful to Erikson for their incredible work here. And I saw that Juliet is joining us today, so maybe we can, ask her some questions in the chat too. But I also want to sort of share that this is an iterative body of work. What we are sharing with you today is our best understanding of where we are at this moment, but really see this as living work that will benefit enormously from your input, your feedback, and your use of this tool, in the field. So really see this as a living and breathing document, and one we hope you all will consider contributing to. Next slide, please. I wanted to share a little bit about how the network the benchmarks were developed, just so that you have a little bit of background. Our partners at the Erikson Institute conducted a literature review to really identify what evidence currently exists around effectiveness and impact of networks. Unfortunately, that evidence is pretty limited. However, they looked beyond that body of evidence to other literature around broader supports for home-based childcare and really, looked first at what the evidence says. The second part, and really I think the richest part, is that we went out into the community. Many of you may have participated in this process and engaged directly with providers, with staff and administrators of networks, with a number of reviewers, as well as folks on our team that work to support folks in thinking about networks. We also engaged additional stakeholders at the national level to take a look at these benchmarks and indicators and give us input. Again, there's more to do here, and we are eager for what you are learning and what you all are thinking about to contribute to this evolving body of work. So now I'm going to turn it back over to Karen, who is going to walk you through the benchmarks and indicators, and we're going to get a little more into the content of the report.
Great, thanks. So let's dive into an overview of what's in the benchmarks. So if we could go to the next slide, we have a graphic that shows all 11 of the benchmarks. The benchmarks are grouped into 3 broad categories: the why, the what, and the how. And in a few slides, we're going to dive into each one of these. But first, on the next slide, we just wanted to give you an overview of how the benchmarks are structured. So each of the 11 benchmarks articulates what we call a broad principle of network quality. So that's at the highest level. And then under each benchmark, we have a range of what we call indicators that operationalize that principle. So the idea with the indicators is that they're more specific. They're the features, practices, and approaches that work together to achieve that broad principle or that benchmark of network quality. There are between 3 and 8 indicators under each benchmark. And then many indicators include specific examples of these features and practices described in the indicators. So today we'll talk about each of the benchmarks and one example indicator, one indicator under each of the benchmarks. And then we'll also hear from some of our partners about real life examples of how they are using these in action. So if we go to the next slide, first we want to focus on the why benchmarks. So the why benchmarks represent the values and the goals of the network. This is why a network does what it does. So the first benchmark in this group is related to an organizational culture that is focused on home-based childcare. This means that the organization has an intentional focus on home-based childcare as a distinct, essential, and valued setting for children and families. And if we click next, we have one indicator under this benchmark. As an example, that the network articulates a commitment to home-based childcare as central to the organization's philosophy, approach, and operations. It's not an afterthought, it's really central to the organization. And one way that a network could potentially do this is through their mission statement. If we click again, we'll see another indicator for the next benchmark. So the next benchmark describes providers as equal partners in network governance, decision-making, operations, and accountability. One indicator under this benchmark is that the network supports and compensates providers as leaders through their engagement in distributed decision-making and governance, as well as through co-creation of the network operations. We think this is really essential. A network could potentially do this by having a diverse provider leadership board, advisory groups, including providers on the board of directors, and adopting transparent policies about processes for provider input and governance. And then our last benchmark is under the why is that the network demonstrates an intentional focus on equity and culturally grounded service delivery. So one indicator under this benchmark is that the network prioritizes groups of providers, families, and children who have been historically marginalized in order to increase their equitable access to meaningful and quality resources and opportunities. Other indicators here relate to staff examining their own biases, the network understanding and respecting the background of providers and families, the network taking deliberate actions to support providers who may in the past have had inequitable access to services. We also just want to note here that provider voice and a focus on equity are articulated in their own benchmarks. And as we go through, you'll see that these benchmarks don't stand alone, that these concepts are incorporated and woven through the other benchmarks and related indicators. So if we go to the next slide, I'd like to introduce Danielle Caldwell. Danielle is a longtime family child care provider. She's the owner and director of the Children's Room. And we've had the pleasure, those of us at HomeGrown have had the pleasure of getting to work with Danielle recently. So we wanted to invite Danielle to talk about some of the work that she's doing and how these why benchmarks show up in her work.
Hello, everyone. It's a pleasure to be here today and to talk about the why benchmarks. In the work that I'm doing with networks, it is very important that we understand the culture of home-based childcare. A lot of organizations are focused on centers, and centers have a very different component. Home-based childcare, we know, are focused in the home. It has a distinct, different approach. It is not set up as a classroom, and a lot of home-based networks really focus in on the cultural and the language of the heart of those families. And so focusing in on the unique culture of home-based childcare is very important. And it really slides right into providers as partners. Once again, I'm going to talk about how society has always focused on centers. And as a home-based childcare provider for many years, I have participated in committees, advisory councils, where my voice was only an afterthought. So, organizations would plan, and then they would invite me in at the final hour to say, we had to provide a voice. This is very different in these benchmarks and the frameworks of HomeGrown. Providers are the center of this decision-making process. They're brought in as equal partners, and they guide the work that is being done, which is very, very different. And it's not a top-down approach. If you haven't worked in home-based childcare, you might not know the different modalities that you have to deal with each day. So if you live in your home where you provide care, you might have other people who live in the home. And so that's different. How are you going to navigate through those spaces are going to be a little bit different. Making sure that you have meetings during after hours on weekends. That's focusing and allowing providers to come in and say, well, a meeting in the middle of the day is really not going to work for me because I'm at work. And also understanding the equity issues. What are the barriers that would lead to participation? And what is the historical perspective of home-based childcare and childcare in particular? And to make sure that you are culturally grounded and that you understand the culture of these providers when you are offering services for them. So it is intentional, and this is something that is very different that you see in a lot of CCR&Rs. It's very fit into the mold that we have, but instead the Y benchmarks are intentional about thinking about the culture of home-based childcare, focusing and centering the voices of providers, and thinking about the historical perspective of race and equity in home-based childcare. Thank you.
Thanks so much, Danielle. If we could go to the next slide. So next we turn our attention to the what benchmarks. So this group of benchmarks articulate the network services that support the providers and families choosing home-based childcare. It's really what the network does. So the first benchmark relates to provider well-being and attachment to home-based childcare work. So this includes providers' psychological well-being, their physical well-being, opportunities for educational advancement, learning, and career and professional advancement. So if we click, we should get an indicator about nurturing provider psychological and physical well-being by reducing stress from difficult work conditions and helping to improve work-life balance. So we know this is a challenge, but one way that networks can help support providers with this is by offering services that relate to self-care, stress reduction, hosting activities or events that help reduce isolation, offering to connect providers to other resources. So if we click next, the next benchmark is that the network offers services that promote economic well-being and sustainability. We know this is another crucial benchmark and crucial area where providers need support. One indicator here is that the network helps providers maintain full enrollment to ensure steady and reliable income. And the other indicators under this benchmark include facilitating providers' access to benefits, supporting providers' business operations, helping providers manage expectations, offsetting the cost of business through financial aid and material supports, and helping providers to navigate federal, state, and local regulatory systems. If we could click next. The third benchmark under what relates to supporting quality. So the network offers services that build on and enhance culturally relevant and community embedded provider practices that contribute to positive child and family outcomes. One indicator under this benchmark is that the network builds on provider knowledge about working with children and families. So networks can do this in a variety of ways, including training, technical assistance, peer support activities. We see a lot of networks that already do a lot of great work in this area. Other indicators relate to health and safety practices, creating nurturing environments, positive provider and child interactions, planning both formal and informal learning activities, and engaging families. And then the final benchmark, if we click next in this group, is that the network offers holistic services for children and families beyond the supports offered for providers. So this includes, knowing about ways that providers offer supports to families, keeping up-to-date lists of community resources and services, referring children and families to resources as needed, and then following up with families to ensure that they were able to access the resources. One indicator in this group is, in this benchmark, is that the network refers children as needed to develop mental health and nutrition and mental health screening and assessment, as well as mental health consultation. So if we could go to the next slide, I'd like to introduce Ansley Heron. So Ansley is the Family Support Lead with the Smart Start of Transylvania County in North Carolina. And so we wanted to invite Ansley to talk a bit about the great work that they are doing when it comes to the WHAT benchmarks.
Hello, guys. I'm so happy to be here talking with you all today. And I just have to say how appreciative we are of HomeGrown for the opportunity to really support our home-based childcare network in Transylvania County. North Carolina actually does not support family, friend, and neighbor care. They don't recognize it as a form of childcare. So it's been a great ride just to be able to bring support and wellness to these providers. So like Karen said, I'm going to be talking about the WHAT benchmark. So for provider well-being, we have brought our family, friend, and neighbor care providers together, and our family child care home providers. We have 2 of them in our county. We have a very small county, but they meet and they help each other. We are focusing on our family, friend, and neighbor providers at the moment because of the large number of them. We currently have about 75 in our very rural small county, which is a huge deal for us. This is a small picture of them in the top of the screen. But they meet once a month at least to get together, talk about their own struggles with the children they're caring for within themselves. They talk about fun activities they're doing to share ideas. During this time, they often work on advocacy efforts using their provider voice. And recently, our provider leaders have started making meetups throughout the month. So they have gone to the park together. They've done a clothing exchange, just all of these services to help support each other. And we have a network facilitator that just rides alongside them because the provider voice is definitely what we're focusing on. And it's really cool to see them all be able to come together and support each other in what they're doing. The finance instability piece. So most of our, I think it's 87% of our family, friend, and neighbor providers are not compensated at all for the work they do. They're doing it as a favor to their family and friends. So we provide a monthly stipend for them and nutrition supplements. They receive gift cards to Aldi to grocery shop with some healthy meal guidelines that we share. The comprehensive services, which is at the bottom, but I'll skip around just because it flows better. They have a nutrition class going on right now where they cook with the kiddos and work on some healthy meals, just able to provide them to that, as well as the budgeting tools for their daily operations. We partner with a local credit union, and they are fortunate to offer free trainings, supported trainings through the network that we're facilitating, as well as individualized one-on-one budgeting support, which has been hugely beneficial to these providers. And for the quality practice, what works best in our county definitely doesn't work best everywhere. But because it's so important that we are getting these families out into the community in our area, we just have created a monthly activity roadmap. So we utilize our partners in the county a lot, such as the library, our Children and Family Resource Center, and the families go around to all of the different places. Sometimes they meet up with each other so their kiddos can play and they can chat. They have story times and educational play groups, etc. So it's just really coming together nicely to support all of these areas. And the biggest support I think within is themselves, because they're always chatting with each other on, we have a software program, Playground, that we use that I think I'll talk about in a little bit. But they use Playground to chat with each other and meet at the park, etc. So it's just been incredible to see the evolution from not knowing each other to becoming the best of friends and support for each other.
Thanks so much, Ansley. We really respect and admire the work that you all are doing. And we're going to invite Ansley to speak again in just a moment when we get to our how benchmarks. So if we could go to the next slide, let's go ahead and take a look at those how benchmarks. So these benchmarks reflect evidence-based implementation strategies that networks can use. The first benchmark in this group is that the network uses research evidence to inform how services are implemented, including a focus on the relationship to service delivery. So this is both a focus on relationship-based approaches to service delivery, as well as other logistical considerations. So if we could click next, an example indicator is that the network builds successful collaborations with providers and delivers supports to providers that acknowledge and build on provider strengths. So you'll see again the themes that we spoke about earlier with the why benchmarks. The next benchmark is relating to the use of data for improvement and evaluation. So an indicator here is that the network collects meaningful data on the network operations that are driven by the theory of change and provider voice. I think just click next there. Other indicators under this benchmark are related to having a theory of change, having policies and procedures in place to ensure data security, analyzing data to examine implementation, and sharing findings with stakeholders, including providers and families. If we click next, the third benchmark relates to using intentional staffing strategies. So these indicators relate to hiring staff and recruiting program staff that specifically work with home-based childcare providers and staff who bring an understanding of and respect for home-based childcare. We heard Danielle talk about some of the differences between other types of care and home-based childcare. So ensuring that staff are embracing of home-based childcare specifically. Other indicators under this benchmark relate to job training for staff, supervision, wages and benefits, and career advancement for staff. And if we could hit next, the final benchmark under how benchmarks is about recruitment strategies that result in ongoing provider participation. All of the rest of the benchmarks don't mean anything if we don't actually have providers who are participating in the work of the network. We need to bring them in order to support them. So one indicator here is around collaborating with trusted community partners such as schools, Head Start programs, family child care associations, and faith-based organizations to help reach out to and engage home-based childcare providers. That is a super quick overview of the benchmarks. There is much more detail in the document. I believe Natalie has dropped it in the chat and we can share it again if needed. But we encourage you to take a close look at all of the benchmarks. On the next slide, we dig into a couple of examples of the how benchmarks in action. So I'll voice over a few of these and also invite Ansley in. But related to that benchmark around service delivery, one of the indicators here is around designing services that address the logistical realities that providers experience, including consideration for scheduling and location. I think Danielle shared an example of this earlier. We also wanted to share an example from a provider that we work with closely, Pam Childress in the Chicago area, of how she partnered with her network to help improve service delivery. So Pam's local CCR&R agency is about 30 miles from her home, often a challenge for her to get there. And especially during the pandemic, she found it difficult to access the free PPE resources from her CCR&R. CCR&R announced that the pickup hours for the PPE would be during the work week at a time when the home-based providers are actively caring for children and unable to step away from their programs. So Pam spoke up about this challenge. She voiced her concerns that the resources were not truly accessible to home-based childcare providers. And in response, her local CCR&R rented an additional location to meet the needs of the providers in her area. So this was a really encouraging example, both of how a provider's voice was respected and how a network made adjustments to address the provider's logistical realities and better address the benchmark. So under data collection, we wanted to highlight these two indicators in particular. I1 is around creating a theory of change, and I2 is around collecting meaningful data driven by provider voice. So this is where I was going to invite Ansley to step back in and talk a bit about your use of Playground.
Definitely, I will cover this briefly. There's a lot I could say about Playground, but I will focus to the data collection piece. They have been a wonderful software program to work with. They are childcare management software that has completely renovated their software so that it's accessible to home-based childcare providers, as well as family, friend, and neighbor care providers that serve a smaller group of children than these large license centers. So it's been incredible to see them have access to a software that does all the same things. But I think the piece that is most beneficial on the back end, the front end, they would tell you a completely different story, of course. They like the chat and the news feed features. But on the back end, we're collecting data all alongside of this. So we're able to collect demographic information from their profiles. We track turnover rates of children that they care, which are very low, that they care for. They're very low. We track meal plans on there to see what they're purchasing with their reimbursement. And we also are tracking child development, as that is a huge piece to our home-based childcare network, is that we want to ensure the quality is there and that they are receiving, like in the home settings that are unlicensed and unregulated specifically, that they are receiving the same quality of childcare because they have access to these resources now. So they are filling out developmental ASQs on our software, so they're able to track it and see that they're headed in the right direction. And when we notice trends that aren't, we're able to refer them to outside resources. So it's super cool to be able to track this all in one place and use it to support these caregivers, families, and children.
Thanks, Ansley. Really appreciate that example of how it's not just data collection, it's data that's informing their practices and really supporting the providers themselves. Thanks so much. And then we just want to highlight two more indicators under these last two benchmarks here. So under the staffing benchmark, the indicator J2 is about recruiting and hiring staff that reflect the cultural, ethnic, and linguistic backgrounds of home-based childcare providers in the network. It speaks to the importance of practicing language justice and offering supports to providers in the language of their heart. Networks that do this well tend to hire from the communities that they serve and take on the responsibility of interpretation and translation. We often hear anecdotes from bilingual providers who take on this task themselves without compensation to better support their peers who may only speak a language other than English. But it's the role of the comprehensive network to do this work. And our partners in the city of Hartford, Connecticut, do a great job of supporting their Spanish-speaking providers providers. The lead for their project, Anna, is both a native Spanish speaker and a former family child care provider, so truly reflecting the community that she serves. I also want to highlight Anna's work for the benchmark on recruitment. So one of the indicators here is about tailoring recruitment strategies that are culturally and linguistically responsive to the ways that providers may access information, which may look different for family child care and FFN caregivers. So Anna, again, has been among the Latinx community hosting events and trainings in Spanish, really trying to do outreach and recruit family, friend, and neighbor caregivers. You know, it's taken some time to build that trust and relationships with these providers, but the network is beginning to see more FFN caregivers attending events, asking for resources, and generally engaging more fully with the network. So that network is really seeing success by tailoring their recruitment process to the community. All right, well, that was a quick overview of the benchmarks, and hopefully some of these examples helped bring some of them to life to see what this really looks like in action. I'm going to turn it back over to Natalie to talk a bit more about how folks who are just getting started could look at using the benchmarks.
Great. We can go to the next slide, please, Ingrid. So if you're wondering, how do you even begin using these benchmarks? And if you've looked at the report and you're feeling a little overwhelmed, fear not. I think there are lots of different ways to attack this, this document. And I think a lot of how you come to the benchmarks and how you might use this set of benchmarks and indicators really depends on where you currently are in your journey of either creating or enhancing a network. And so we strongly encourage you to think really critically about your kind of current interests and your current capacity. We really do recognize that in order to offer all these services and to have, you know, all the implementation components is costly, and that you may not have access to funding, or there may be other constraints in your community to do all of this. If you are just starting out or thinking about conceptualizing a network, you might consider using the benchmarks and indicators as a way to establish theory of change, to think about some of the services and impacts you might want to have on the providers, children, and families in your community. If you are already operating a network, you may want to hone in on a couple of benchmarks or indicators as areas for ongoing improvement. So given the theme of today's discussion, we hope that you will all take a really close look at our provider wellness indicators and think about to what extent your network is currently meeting those indicators, and if there are opportunities within your network to enhance your provider wellness supports. Then indicators can offer you strategies you might consider and think about how you might know when you've succeeded in doing so. In the spirit of being comprehensive, you know, we really do hope that networks are able to work collaboratively with their public funding partners to aim to meet all benchmarks and indicators and ensure that there's equitable access for the providers in your community. But we recognize that that may not be where you're starting, and that may be a journey or an ambition for your network over time. Next slide, please. We are often asked if we think, can all these be achieved? You know, and again, it is our hope that this is an ambition for all networks to be able to both offer these variety of services, but to also operate in the why and the how benchmarks to really support providers. So there are some examples across the country of networks that are getting pretty close to comprehensive, that have the varied services that they offer, that have strong structures for provider leadership and decision-making, and that are using implementation strategies like data collection and evaluation and culturally congruent staff. And, you know, I think that is for the most part possible when there is significant and concentrated public funding that supports this. So one might look at an example like Early Head Start Child Care Partnerships as an example of networks that have a lot of the components in the benchmarks and indicators. And I think it could be very challenging if you are a network that is sort of operating outside of a hub or is not connected to some of those components. What comprises the hub of the networks in this comprehensive strategies may not be one organization. And so one of the things I might encourage folks to think about as you're thinking about how to accomplish all of these different networks is to think about that strategic frame that Karen offered, and to think about whether there are strategic partnerships that might help you advance that. So perhaps your organization is a provider-led network that you rely on memberships and maybe some nonprofit funding to do your work, and that you have culturally competent staff, and you have really close and trusted relationships with, providers, but you are not yet at the place where you maybe can process provider subsidy payments. Perhaps there's an opportunity to partner with the CCR&R and to really build a vision for that hub with strategic partners around the table. We do not assume in this model that the hub is doing all the service delivery, right? We assume that the work of the hub is really coordinating and collaborating with community resources. Again, you may not need to hire mental health staff if you have an MOU with a local mental health provider who's really a part of your hub. So I think that's all a way of saying that we hope that the benchmarks really inspire you to think about how to either create or enhance your network. We also recognize that this is aspirational and requires a lot of resources. And so we hope that this gets you started on your journey and can help you kind of continue to progress as you build out, enhance, and increase the impact of your network. I'd like to just leave with some words of wisdom from a provider. Ingrid, if you don't mind going to the next slide. Chris Nelson, who is a provider based in Vermont and who also supports HomeGrown as our provider in residence, shared this quote, which I think really, in the spirit of being inspiring, it certainly does it for me. She said, "Networks can build a strong foundation that's measurable, sustainable, and accountable to all stakeholders. Strong networks strengthen providers. Strong providers strengthen families. Strong families strengthen their communities." And we hope that this can be a resource to you and your communities as you build out your networks. So I think at this point, I am going to hand it back to Danielle, and we're going to transition into some discussion.
Fantastic. I think we have time for probably 2, maybe 3 questions. If anyone has anything they're really curious about in these last couple minutes. I see there's a little bit of chatter, and thank you, Juliet, for being here and providing the extra resource in the chat. We appreciate that, and all your work at Erikson on this topic as well. Is there a benchmark or benchmarks that a network should focus on as being foundational in building a comprehensive network?
Well, I can.
Like a big question.
It's hard to pick just one. I could offer a few thoughts, and then Natalie, please chime in as well. What I'll share is that we worked on developing the benchmarks in partnership with Erikson for quite a while, with lots of input from providers and lots of different stakeholders in the field. And as we were getting closer, we started playing around with how do we visually represent this? And are there some benchmarks that we think need to be like at the foundational level and then others above them? And I think we came to the conclusion that these groupings of the what, the why, and the how were more accurate, that we didn't necessarily want to position some as foundational and some as occurring later. I think we at HomeGrown do believe very strongly in the why benchmarks in particular, that a focus on home-based childcare providers and partners and equity are essential, and that's why those benchmarks are their own but are also woven through the other benchmarks. So needing to start really grounding yourself in the why is super important, and we've found that a lot of our partners have come to that realization too, that they might come in with a focus on the what or the how, but quickly realize that they might need to take a step back and build those provider governance structures. So I guess officially we would say that all of them are important, and there is none that we would pull out as foundationally, but that we do attach a lot of importance to the why benchmarks. Natalie, I'd invite you to chime in, and then Natalie, Juliet, feel free to add in the chat as well.
Yeah, I mean, I don't think I have much to add. I would just say that I think I think when you envision a network that offers services but does not share power and decision making with providers, that doesn't feel right. But it's also hard to imagine a network that shares power and decision making with a provider but doesn't have services or strategies, right? So in some ways, I think you're always working on these things in, with each other. And a way you might consider using this tool is really as a self-assessment. How are we doing on these different benchmarks as a way to say this is where we should focus more than the other. If you are truly starting to build from the ground up, I would say you need to build something in every area, right? Because one without the other is really not a network. Danielle, if you don't mind, I wanted to just drop a resource in the chat that relates to a question that was much earlier in the discussion. I'm sorry, I forget who asked the question, but it was around mental health resources for providers and access to insurance. And I just wanted to drop this new little brief that we published that really is written to network administrators as an opportunity to think about helping providers connect to public benefits, including health resources.
Fantastic. Well, I want to thank HomeGrown and Karen, Natalie, Danielle, and Ainsley for sharing the benchmarks, this overview. We know there's a lot more to dig into, and so if this will be sent out, the recording, the resources, the PowerPoint will be all sent out. So as we think about wellness, and just want to, in closing, take a minute and have everyone just pause and think about one thing from today's session that you're going to take with you. Is there one idea that was new, or one thing you're curious about, coming back to your own location, your own situation, that this has made you think about in a new way? Anything like that, if you want to put that in the chat, we appreciate it. Ingrid, if we could go to the next slide. So everyone's contact information will be included in the PowerPoint that you'll receive. And go to the next slide. And we just wanted to mention that our next offering will actually be the Build Conference, which is a little bit different this year. It was postponed earlier. We now have a virtual session on Monday and Tuesday, November 13th and 14th, and then we'll be in person in Anaheim, November 29th through December 1st. So hopefully we will be able to see some of you there. And go to the next. And thank you for we will capture these as well as these and include those in the report out. Really appreciate everyone's attendance. And as you leave, a little survey is going to pop up, and we always want to be responsive to what's important to you, what you're thinking in the moment, what you thought about the presentation today. So if you can just take a moment to answer the questions as they pop up, we will leave you and wish you the very best afternoon. And thank you for everything you do for families, children, and educators.